Good, happy Tuesday morning, March 17, 2020. And happy St. Patrick's Day, everyone. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday morning, so let's begin. First up, COVID-19 coronavirus in New Hampshire, what you need to know. Officials detail symptoms and number of cases. "17 Granite skaters have tested positive for coronavirus disease, COVID-19, which was first detected in Yuan City, China. New Hampshire data. Number of positive COVID-19 tests, 17. CDC has confirmed 2 of them. Number of pending COVID-19 tests, 195. Number of negative COVID-19 tests, 355. Number of people tested, 567. And number of people being monitored, 534. On March 11th, 2020, the World Health Organization declared COVID-19 outbreak a pandemic. On March 13th, 2020, Governor Chris Sununu declared a state of an emergency, which ensures resource will be ready so the state is able to respond quickly as needed. Symptoms. Officials said symptoms might appear in a few as 2 days or as longer as 14 days after exposure. Symptoms include fever, cough, and difficult breathing. According to CDC, emergency warning signs for COVID-19 include difficult breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability of arouse, blush, lips, or face. The difference between coronavirus, flu, and allergies. Here is a look at the differences. Protecting yourself. The best way to prevent an illness to avoid exposure to the virus, officials said. Preventing the spread. Schools. Governor Sununu on March 15th ordered all K-12 public schools to close. Remote learning must begin through those schools by March 23rd. Schools will be closed until at least April 3rd or maybe longer. The order does not apply to private schools, though officials said many are following suit. Similar plans to close schools and pivot to online instructions. How testing works. Insurance information. Emergency Operations Center now open from 7 a.m. to 7 p.m. 7 days a week. And COVID-19 in New Hampshire. 17 number of people in New Hampshire who have been tested positive for COVID-19. 179,073 number of people worldwide who have tested positive. 0 number of deaths from COVID-19 in New Hampshire. 71 number of deaths from COVID-19 in the United States. And 7,74 number of deaths from COVID-19 worldwide. There are 5 people in Grafton, 1 person in Carroll, 1 person in Hillsborough, and 10 in Rockingham. In the common symptoms, fever, cough, and difficult breathing, how it spreads. In prevention tips. HHS, person under 18 years old among 4 new positive COVID-19 cases in New Hampshire. 4 more cases of COVID-19, including one in a person under the age of 18, have been diagnosed in New Hampshire, bringing the total to 17, health officials said Monday. The new cases were in Rockingham, Carroll, and Grafton counties, and involved 3 men and a girl under the age of 18. She is the first minor to be diagnosed with COVID-19 in New Hampshire. All patients are isolating at home, and household contacts have self-quarantined, health officials said. Health officials said almost all the cases in New Hampshire have been related to travel or close contact with someone with COVID-19. One person's risk factor are still under investigation. Officials said 195 tests are still pending with the state, and 525 people are being monitored because of the increasing number of tests. Health officials said it will now take up to 2 days to get a result. Some hospital laboratories are developing capacity to test for the coronavirus. Those test results take 3 to 5 days, officials said. Dartmouth graduate student confirmed presumptive positive for COVID-19, school officials say. Graduate student living in off-campus housing. A Dartmouth graduate student living in off-campus housing has been confirmed to be presumptive positive for COVID-19, according to a release from school officials. In a statement from the school, presumptive COVID-19 task force Chris informed school officials that 3 members of Dartmouth community were being tested on Monday morning. By Monday afternoon, 1 positive case was announced. The student undergoing tests have followed protocol by staying in their homes and are working with New Hampshire Dartmouth of Health and Human Services during their contact investigation. New Hampshire DOE Commissioner Etta Blute answers questions about school closures. Schools to still install online lessons by next Monday, per governor's order. Let's take a listen to that video from WMUR News 9.
We have less than 100 dairy farms left in New Hampshire. Tell your grocer today to carry milk with New Hampshire's own logo.
You can't get any more local than buying it from the farmer.
Please help save our farms.
The State Education Commissioner says students can follow the lead from teachers and school staff ready to handle this learning curve.
I would just encourage the students to work with their school district as we work through this transition and know that the educators are there to try and help them and support them in what they're trying to do.
Taking viewer questions live in studio, Frank Edelblue said community college systems, which are on break right now, are working on going to remote learning. That residential schools can continue on their contained campuses, and private schools are also taking action.
Many of the The private schools have adopted a practice that looks a lot like some of the way the public schools are doing it, and switching to kind of remote instruction and remote support.
He noted that some special education students may still receive in-person support at schools or be compensated for necessary services, that the state is working with cable providers to help students who need free internet access, and says it's within CDC guidelines for a few students to work together if they practice safeguards like social distancing and hand washing.
Maybe it's 5 or 6 students that are getting together and working on a project. So certainly when you add one child, it's going to increase the risk, but those smaller numbers are safe for students to be able to work together.
The Department of Education website now has a help desk where you can submit your questions and get answers. We've provided a link to that on our website, WMUR.com.
Okay, and there you go on that video and that report. Governor orders New Hampshire restaurants, bars to shift to delivery, takeout only. Move follows similar order in Massachusetts ahead of St. Patrick's Day. Let's take a listen to that video from WMUR News 9.
It's the Honda Dream Garage Spring Event. The perfect time to get that awesome new Honda you've been dreaming of. Like?
No public gatherings of 50 people or more, and New Hampshire bars and restaurants limited to takeout, delivery, and drive-through only. Those are the directives handed down from the governor's office late Monday afternoon.
It's absolutely devastating to us, the downtown, the owners, the service industry workers in the city, trying to process it all, and tomorrow's such a big day for so many people.
St. Patrick's Day is one of the busiest and most lucrative days of the year for New Hampshire bar owners. Many spent thousands of dollars on food and alcohol in preparation for the celebration. Now they're scrambling, finding creative ways to unload some of that inventory. Mike Summers, the president and CEO of the New Hampshire Lodging and Restaurant Association, says owners will be working through the night.
You got to appreciate the ingenuity. So I know a lot of folks are suddenly offering St. Patty's Day meals for delivery, for takeout. They're basically working within the systems they've got. We're certainly seeing some creativity here, but again, nothing's really going to replace a busy St. Patrick's Day.
Summers says the hospitality industry employs 67,000 people in the state of New Hampshire. There's a great deal of concern from the business members as to how they will help those employees through this difficult time.
We will stand behind our employees, and we'll find work for them somehow.
So it's obviously difficult to predict the exact financial impact that this will have, but Mike Summers says it will likely be in the millions of dollars. Live in Manchester, Jason King, WMUR News 9.
Okay, and there you go on that video and that report. Hospitals try to preserve resources for those who are sickest. Anyone who might have symptoms of COVID-19 asked to call doctor or 211. Let's take a listen to that video from WMUR News 9, Mike Cronin.
At Beltates, customers will find everything they need for a building project. The brand names you trust to perform. And with a fleet of over 50 delivery vehicles, we deliver when and where our customers need them. Beltates Building Products. 9 locations throughout New Hampshire and Massachusetts.
New Hampshire's hospitals are changing to deal with the present and future of COVID-19. There are exceptions, but most visitors are prohibited, and surgeries are being limited to only necessary ones.
We have this under control. The hospitals are preparing for worst-case scenario so that we do not have what happened in Italy or in China.
Elliott Hospital and Catholic Medical Center are preserving resources to prepare for a potential surge in patients.
We are working with other hospitals and ambulatory care centers about their ventilators and about their surgeries and trying to conserve personal protective equipment as well.
As for testing, if someone suspects coronavirus symptoms, hospital leaders say to call primary care providers or 211. But officials stress don't show up at the emergency room and expect to be tested.
If they have a true emergency, they need to come into the emergency room. But that shouldn't be used to just request testing because they will be turned away.
Medical experts say everyone has a role in stopping the spread of COVID-19.
The social distancing has become a buzz phrase now. I encourage everyone to take that very seriously. I think if you don't have to be out and about or socializing with other people, you're really doing the public a service.
Dr. Greg Baxter says tackling the virus will be a marathon, and we're still at the front end of it.
This is uncharted territory, okay? But what it means is we have a chance to meet the challenge.
And meeting that challenge will mean looking out for each other, and hospitals say they'll be ready to care for those who truly need it. Reporting live in Manchester, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. Salon, cinema, chain close doors to help control the spread of COVID-19. Employees let go aimed concerns over coronavirus. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
It's the Honda Dream Garage Spring Event. The perfect time to get that awesome new Honda you've been dreaming of. Like the versatile HR-V. Or the award-winning CR-V. Or the legendary Pilot. Whatever your dream may be. Where'd that dream come from? It's weird. Get to the Honda Dream Garage Spring Event for an amazing deal. Because around here, we Honda.
The owner of the studio on Elm in Manchester is busy closing up her salon. She just made the decision on her own to close her doors.
This isn't about money. This is way bigger than us. It's bigger than money, and I knew that, honestly, I had to do the right thing.
And the right thing meant letting 5 of her employees go for now.
I know this decision was so hard for her to make. It wasn't easy. She was thinking not only about herself, but all of us, which she always does. So I know in my heart that when she made this call, it was because she had to.
Other businesses in the state are in similar situations because of CDC recommendations. Chunky's Cinema is closing its locations in Manchester, Nashua, and Pelham.
It's a difficult time for us, for our staff, for our suppliers. Luckily, everybody's very professional about it, and we'll get through this.
CEO Alan Coburn says their entire staff will be let go in the next 2 weeks, with the exception of some managers to maintain the 3 locations.
It's awful. It's the worst thing probably that we've ever done. It's a lot of sleepless nights, knowing that this could happen. It's just terrible.
Management is now directing employees to unemployment services. The salon is looking into that as well.
People need to start closing their businesses. We need to stay away from each other. We need to bring this to an end. But we're not, if people keep going out and keep getting services done, and it's not going to happen.
The salon owner here in Manchester is asking other business owners across the state to consider what they can do to help as well. Reporting in Manchester, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. MBTA to implement schedule changes today in effort to curb coronavirus spread. Subway, commuter rail, ferries, and buses are all affected in Boston. Let's take a look at that schedule for all of you. According to MBTA, the modifications include all right here. Also, earlier This month, the MBTA started cleaning frequently touched surfaces like handrails and ferry gates in stations every 4 hours. Vehicles were to be cleaned and disinfected daily. Five new COVID-19 cases announced in Maine. Now 17 total, health officials say. Let's take a listen to that video from WMTW News 8 Maine.
Fact, not all synthetic motor oils are created the same. Crude oil is a bit like a bag of mismatched rocks. Natural gas is more like a bag of marbles, all uniform in size and shape, which reduces friction in your engine. Pennzoil is made from natural gas. The proof is in the Pennzoil.
Behind all of these numbers is a person, someone's spouse, someone's brother, someone's mother, someone's daughter, and we ask everybody to ensure that we treat them with kindness so that they can achieve a speedy recovery.
An important message from the Maine CDC tonight to put the numbers in perspective. Here's how they break down as of the last update. There are now 17 total confirmed or presumptive positive cases in the state. 2 individuals are in the hospital. The rest are isolating at home. The Maine CDC says it's asked for more test kits, with testing ramping up and evidence of community transmission in at least Cumberland County. It plans to work with restaurants and food service providers to help them manage social distancing recommendations. Maine health officials are also concerned about shortages of personal protective equipment for healthcare workers, but working with the federal government to bring in more via the Strategic National Stockpile. The CDC ended today's briefing with the following commitment amid the uncertainty.
We at the Maine CDC are following the best available science, and we will continue to ensure that our response is driven by that scientific data, and we will also pledge to be transparent with everybody when we have changes. Thank you very much, everyone.
And this situation was anticipated. Officials have been telling us since last week that they expected a spike in confirmed cases here in Maine and nationally, with more testing being available, and that will likely continue in the coming days and weeks. That, of course, is why all these precautionary measures are being taken.
Okay, and there you go on that video and that report. Dow features jump beyond 700 points after Wall Street suffers worst day since 1987 market crash. Stocks futures traded higher on early Tuesday morning after Wall Street suffered massive losses on Monday amid concerns over the economic blow from the coronavirus outbreak. Trump gives himself high marks in coronavirus fight. Let's take a listen to that video from ABC News.
President Trump acknowledging late today the virus is not under control and sharing his own personal experience, what his young son asked him, as many Americans fear that what they're seeing in Europe is about to play out here. Here's ABC senior White House correspondent Cecilia Vega tonight.
Despite widespread delays over testing and repeated mixed messages from his own administration, today President Trump gave himself high marks.
And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job.
Does the buck stop with you?
Yeah, normally, but I think when you hear this has never been done before in this country.
But the confusing messages from the administration continued. The New York Times reporting that President Trump stunned some of the nation's governors in a conference call, telling them they should not wait for the federal government's help with respirators, ventilators, and other critical life-saving equipment, telling them they should, quote, try getting it yourselves. Asked about that today, the president did not back down.
If they can get them directly, it's always going to be faster if they can get them directly, if they need them. And I've given them authorization to order directly.
President Trump had said the virus would just disappear. Now he's marking a shift in tone.
How are you talking to your own family about this? How are you talking to your youngest son? Do you empathize with this sense of anxiety? People are really scared.
Yeah. No, I think they are very scared. what you can do, and all you can do is professional, totally competent. But I think that what we do, and I've spoken actually with my son, he says, how bad is this? It's bad. It's bad.
The president himself was exposed to the coronavirus a little over a week ago. The Brazilian official in this photograph tested positive. The president was tested himself on Friday. He says the test came back negative.
Not something I want to do every day, I can tell you that.
And the vice president said today that he has not been tested. He says that he is in constant touch with White House doctors, David, but that so far he is not showing any symptoms.
All right, Cecilia Vega tonight. Thank you, Cecilia.
Okay, and there you go on that video and that report. And that is it for this morning edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.